BCEN Test Prep Exam Book 2018. Question 1. The antidote for acetaminophen overdose is Option A. Naloxone, Option B. N-acetylcysteine, Option C. Flumazenol, Option D. Sodium bicarbonate. The correct answer is Option B. N-acetylcysteine. Question 2. A drowning victim who was submerged in cold water has a higher potential for successful resuscitation because Option A. Cold water causes coronary artery dilation. Option B. Hypothermia decreases metabolic demand and provides neuroprotection. Option C. Cold water flushes the lungs of bacteria. Option D. The mammalian diving reflex eliminates the need for CPR. The correct answer is Option B. Hypothermia decreases metabolic demand and provides neuroprotection. Question 3. A patient experiencing a tonic-clonic seizure is in the emergency department. What is the priority intervention? Option A. Restrain the patient firmly. Option B. Insert a bite block. Option C. Maintain airway and administer benzodiazepines as ordered. Option D. Obtain a stat CT scan. The correct answer is Option C. Maintain airway and administer benzodiazepines as ordered. Stressed about your BCEN exam? We can take BCEN exam for you remotely and undetected. We always guarantee a pass and payments only after results. To send us an email, scan the code or tap the link in the description and let's get it done. Question 4. A patient presents to the emergency department with a laceration that requires sutures. During the procedure, the patient states they feel faint. The nurse's first action is to Option A. Administer oxygen. Option B. Place the patient in Trendelenburg position. Option C. Immediately discontinue the procedure. Option D. Assess vital signs. The correct answer is Option C. Immediately discontinue the procedure. Question 5. The hallmark sign of compartment syndrome is Option A. Pain relieved by elevation. Option B. Pain out of proportion to the injury. Option C. Absent pulse in the affected extremity. Option D. Pitting edema. The correct answer is Option B. Pain out of proportion to the injury. Question 6. The classic triad of symptoms for a ruptured abdominal aortic aneurysm, AAA, includes Option A. Hypertension, bradycardia, headache. Option B. Abdominal pain, hypotension, and a pulsatile mass. Option C. Fever, chills, flank pain. Option D. Dysuria, frequency, urgency. The correct answer is Option B. Abdominal pain, hypotension, and a pulsatile mass. Question 7. A patient presents with tearing chest pain radiating to the back. Blood pressure in the right arm is 190/100 mmHg and in the left arm is 130/80 mmHg. The chest X-ray shows a widened mediastinum. The nurse suspects Option A. Acute myocardial infarction. Option B. Thoracic aortic dissection. Option C. Pulmonary embolism. Option D. Tension pneumothorax. The correct answer is Option B. Thoracic aortic dissection. Question 8. A patient sustains a laceration and has not had a tetanus vaccine in 12 years. The wound is clean and minor. The nurse should anticipate Option A. No tetanus prophylaxis needed. Option B. A tetanus immunoglobulin only. Option C. Tdap or TD booster. Option D. A tetanus toxoid and tetanus immunoglobulin. The correct answer is Option C. Tdap or TD booster. Are you looking for BCEN exam actual questions? Visit our website pokerexams.com to access BCEN exam study guide with actual questions and answers. Scan the QR code or click the link in the description to get BCEN exam answer key today. Question 9. Carbon monoxide poisoning leads to hypoxia primarily by Option A. Causing bronchospasm. Option B. Binding to hemoglobin with higher affinity than oxygen. Option C. Destroying lung parenchyma. Option D. Causing pulmonary edema. The correct answer is Option B. Binding to hemoglobin with higher affinity than oxygen. Question 10. A patient presents with substernal chest pain radiating to the left arm, diaphoresis, and nausea. The ECG shows ST- segment elevation in leads 2, 3, and AVF. Which coronary artery is most likely occluded? Option A, left anterior descending artery. Option B, left circumflex artery. Option C, right coronary artery. Option D, left main coronary artery. The correct answer is option C, right coronary artery. Question 11. Hepatitis A is primarily transmitted via option A, blood and body fluids. Option B, fecal minus oral route. Option C, sexual contact. Option D, a contaminated needles. The correct answer is option B, fecal minus oral route. Question 12. A patient with acute pancreatitis should have which nursing intervention as a priority? Option A, encourage early ambulation. Option B, keep the patient NPO and provide aggressive 4-fluid resuscitation. Option C, administer high-fat diet. Option D, restrict all 4 fluids. The correct answer is option B, keep the patient NPO and provide aggressive 4-fluid resuscitation. Question 13. A 25-year-old female presents with sudden, severe unilateral lower abdominal pain and vaginal spotting. She has an IUD. The nurse's priority is option A, obtain a urine pregnancy test. Option B, administer pain medication. Option C, prepare for pelvic exam only. Option D, discharge with follow-up. The correct answer is option A, obtain a urine pregnancy test. Question 14. The golden hour for acute ischemic stroke refers to the window for option A, completion of an MRI. Option B, administration of 4 thrombolytics, TPA. Option C, achievement of blood pressure control. Option D, initiation of physical therapy. The correct answer is option B, administration of 4 thrombolytics, TPA. Question 15. Le-Fort fractures are classifications of fractures of the option A, mandible. Option B, mid-face and maxilla. Option C, orbit. Option D, nasal bones. The correct answer is option B, mid-face and maxilla. Question 16. A patient presents with costovertebral angle tenderness, fever, chills, and dysuria. The nurse suspects option A, cystitis. Option B, pyelonephritis. Option C, nephrolithiasis. Option D, renal artery stenosis. The correct answer is option B, pyelonephritis. Question 17. The emergency nurse is caring for a patient with suspected pericardial tamponade. Which triad of findings, Beck's triad, is most consistent with this diagnosis? Option A, fever, chest pain, friction rub. Option B, hypotension, muffled heart sounds, distended neck veins. Option C, hypertension, bounding pulses, headache. Option D, dyspnea, crackles, pink frothy sputum. The correct answer is option B, hypotension, muffled heart sounds, distended neck veins. Question 18. A trauma patient with significant blood loss is in decompensated hemorrhagic shock. Which finding would the nurse expect to see last, as a very late sign? Option A, tachycardia. Option B, narrowed pulse pressure. Option C, hypotension. Option D, tachypnea. The correct answer is option C, hypotension. Stressed about your TSN exam? We can take TSN exam for you remotely and undetected. We always guarantee a pass and payments only after results. To send us an email, scan the code or tap the link in the description and let's get it done. Question 19. A hyphema involves option A, retinal detachment. Option B, a blood in the anterior chamber of the eye. Option C, ruptured globe. Option D, corneal laceration. The correct answer is option B, blood in the anterior chamber of the eye. Question 20. The most common cause of airway obstruction in an unconscious patient is option A, laryngospasm. Option B, foreign body aspiration. Option C, the tongue. Option D, mucosal edema. The correct answer is option C, the tongue. Question 21. A patient with a history of renal calculi presents with severe flank pain, nausea, and hematuria. The priority intervention is option A, forcing oral fluids. Option B, straining all urine. Option C, pain management. Option D, surgical consultation. The correct answer is option C, pain management. Question 22. The most common cause of lower gastrointestinal bleeding in adults is option A, gastric ulcer, option B, diverticulosis, option C, esophageal varices, option D, Mallory-Weiss-Tier. The correct answer is option B, diverticulosis. Question 23. The initial fluid resuscitation bolus for a patient in septic shock, per surviving sepsis campaign guidelines, is option A, 250 ml of 0.9% normal saline, option B, 500 ml of D5W, option C, at least 30 ml/kg of isotonic crystalloid, option D, packed red blood cells to achieve a hemoglobin of 10 g/dl. The correct answer is option C, at least 30 ml/kg of isotonic crystalloid. Question 24. A patient presents with a painful, red eye, cloudy cornea, fixed mid-dilated pupil, and increased intraocular pressure. The nurse suspects option A, open-angle glaucoma, option B, acute angle-closure glaucoma, option C, a conjunctivitis, option D, uveitis. The correct answer is option B, acute angle-closure glaucoma. Question 25. Which type of shock is characterized by decreased cardiac output, elevated systemic vascular resistance, SVR, and jugular venous distension? Option A, hypovolemic shock, option B, distributive shock, option C, cardiogenic shock, option D, neurogenic shock. The correct answer is option C, cardiogenic shock.